Ow! That hurt.
I bet it didn't hurt. Ow! Okay, that actually did hurt. But I bet I have a higher pain threshold than you.
You, a higher pain threshold than me.
I would say so, yeah.
That sounds like a challenge, my friend.
I will take up that challenge.
What does the loser have to do?
You have to forfeit something that girls go through all of the time.
Sounds nice. If you lose, you have to hold a spider in your hand.
That's pretty mean. Okay, game on?
Let's do it. Aside from that bit of silliness, the truth is that whether it's an epic battle or a simple everyday ache, at some stage, pain features in all of our lives.
I've had my appendix out.
My ligaments like 3 times.
3 times?
Yeah, the doctor says if I do it again, I won't be able to walk properly.
Oh God, torn tendon in my shoulder. Oh. Worse than childbirth. What happened to your hand?
I was playing tag rugby and I shattered the bone.
I dislocated and fractured my thumb at the same time.
Oh God.
I didn't know at the time, but the cartilage came out of my knee and the knee locked halfway and I couldn't actually move it, so it was jammed.
Oh Jesus.
Yeah, it was painful.
What
Very
happened?
painful.
What were you doing?
Playing a hurling match for the school.
Childbirth.
Really? Can you
Yeah,
talk? Can you talk me through it? Because I haven't been through it.
Oh God, no.
Pain is the most common reason people visit the doctor, but everyone's experience of pain is unique.
But are some of us more tolerant than others? We've agreed to put our bodies on the line to see which of us can take the most pain.
To help us do this, we're meeting Alice Whitney, a physiologist at Trinity College Dublin, whose work involves studying pain and why it's necessary to our lives.
Oh, we absolutely need pain. It's protecting you. It can be a symptom, so that you could, if something's painful, you go to the doctor and find out what the cause of that pain is. But the problem is when that cause goes and you still have the pain, and it's no longer functional. But in its basic sense, pain is very functional, and it's critical to our survival.
Okay, which ones are the
Okay, let's cut to the chase. Who has the higher pain threshold?
It's not that painful, but basically we want to measure how long you can endure pain and how intense the pain is. You to rate the sensation on this scale, 0 to 100, where 0 is no pain and 100 is the worst you can imagine. So I'll just run this now.
Has it started? Yeah. Okay. Right, well, that's good to know. I'm not a complete wuss. I told you I had a higher pain threshold than Jonathan.
When we hurt ourselves, a signal is sent by chemical messengers to the nearest nerve cell, which relays it along the spinal cord to the brain. These signals can travel at up to hundreds of kilometers per hour. Once at the brain, the signal is sent to 3 areas, those concerned with thinking, emotion, and of course, physical sensation. And all of this happens within a split second.
Alice and her team are working on a treatment which could harness the power of our own brains to fight pain. And we want to see how it works.
Firstly, she places thermos on our hands, which will get very hot or very cold. We have to see at what point that becomes painful. Still very bearable. Fridge cold. Like holding a block of ice now, and that's probably where it got painful.
Because this is hot, like I don't want it to be there, but okay, it's painful now. Alice is working with a technique that controls the function of neurons in the brain. She does this by introducing a low current of electricity to our brains for 15 minutes.
I'll plug you in, shall I? I think you go in here. Okay, put it on to max.
Did you put it in the right way? You've broken it.
It's never seen a brain like mine before.
I can't feel mine, but maybe my hair is protecting me.
See, it's your lack of sensitivity.
It is actually. Jonathan, how does it feel to you?
You know when you were a kid and you used to wee on the electrical fence?
No, because I'm a girl.
Bad example. It's kind of like holding onto a kind of a cow fence.
Okay.
Except it's all over my brain, but it's very slight. I can bear it. Whereas
Yes.
the other one, you'd only wee for a short period of time.
Why would you do that?
A competition. This experimental procedure has been shown to increase the pain threshold for some participants. And now we take the heat and cold test again to see if it had any impact on us.
The neurostimulation seemed to affect you more. You're almost close to zero there.
Oh, so you went to 0 degrees Celsius.
Wow.
It was, whereas previous to that, you were around 10. Now, there was barely any effect on your heat pain. It looks like your pre and post heat pain was exactly the same. It would have been 48.9.
I'm impressed, Jonathan. I hate to say it, but I'm
getting very
impressed.
competitive now. It's not a competition.
Your results don't look like there's been so much of a change. They're kind of pretty equivalent, actually. Your pre and post, so neurostimulation
didn't
seem
have
to
an effect on
have
me.
an effect.
I'm just a blockhead,
Very small
and it didn't actually affect
but
me at all.
This was a big effect on cold pain.
Yeah.
This kind of technique is only in its very early stages of development, but there is a strong hope it may be able to provide a means of treating pain in the future.
Pain is crucial to alert us to a stress or an injury in our body. For most of us, pain will eventually go away, but for some people, pain takes over their lives completely. Chronic pain is often defined as a pain that persists beyond 3 to 6 months. Sarah Donoghue is one of many people in Ireland living with chronic pain.
My experience of chronic pain started back in 2002 with pains and aches in my feet. I was very active at the time, playing badminton 2 or 3 times a week, playing tennis maybe twice a week. It took 7 years to get a proper diagnosis.
Well, we don't recognise chronic pain very well as a disease entity because you can't see it. So people have to sort of subjectively describe having chronic pain. We have to take them at their word that they have chronic pain.
Does that subjectivity make it harder to diagnose?
Exactly. There's no blood test for chronic pain. There's no imaging test for chronic pain. It's a subjective report. The person says they have pain somewhere in the body. You have to try and understand what that pain is, where it's coming from, and come up with an appropriate treatment.
And there are huge mental health ramifications for people living with chronic pain.
There certainly is, yeah. One of the research studies we did here in Galway a few years ago found that chronic pain, the prevalence of depression in chronic pain is 5 times higher than in the general population.
That's scary, isn't it?
It is, yes.
In 2013, I had to give up work. I went from working 24/7 pretty much to having no life. And it took a fairly extreme toll on me. My headache condition had got so bad that I was vomiting every morning. I couldn't lift my head off the pillow. I couldn't sleep. I couldn't walk because I couldn't sleep. I wasn't eating properly. If somebody breaks their leg, it's visible. They have a cast. I have a broken leg inside my body all day, every day, from my toes to my head. Every day I have it. But because people don't see it, it's very difficult. People laughed at me. You know, they thought I was putting it on. But nobody chooses to have the pain that we have. It's changed my life.
Chronic pain causes considerable distress, and like Sarah, many people struggle to get an accurate diagnosis of their problem. We used to think of pain as a result of an illness or a health problem, but now doctors recognise chronic pain as a disease in its own right. At University College Hospital in Galway, the weekly pain clinic run by David O'Gorman and Brian Maguire is proving vital to helping people like Sarah to manage their condition.
I think the best form of treatment would be to approach a patient from a multidisciplinary perspective. So there's no magic tablet, there's no magic injection. It's often a combination of different people being involved in the patient's treatment.
In the pain clinic, specialist doctors and nurses care for patients by helping them manage their medication and prescribing intervention therapies such as nerve blocks and epidurals.
But also it would be involving other people, so it could be physiotherapy, occupational therapy, psychology, psychiatry, and just the relevant medical personnel involved in treatment.
Obviously, we always want people to have hope and to keep trying and to try new things, but that has to be balanced with being realistic and focusing on the possibility, or for some people, the likelihood that they probably will have chronic pain for a long time, if not forever.
Hi Sarah, how are you? How are you doing? The pain clinic changed my life dramatically in that it was probably the first time I met people who actually got what was going on. Before it, I wasn't managing. So now I have the coping strategies in place. I still get very emotional about it. But I think I have the capacity to kind of move on, and hopefully this time next year I'll have maybe a little less pain.
After the break, Fergus talks about the dangers of feeling no pain, and Kathriona looks at how our bodies can produce chemicals that actually mimic some of the pain-relieving compounds found in cannabis.
Is there such a thing as too little pain? Strange as it may seem, it turns out that there is. In the early 2000s, a Pakistani boy was famed for performing street theatre, where he walked on hot coals and stuck daggers in his arms, all apparently without feeling any pain. He attracted the interest of scientists who discovered he had a very rare genetic condition, congenital analgesia, meaning he could really feel no pain. But how is this possible? Our cells contain structures called sodium channels. When we feel a potentially damaging stimulus, our sensory cells leak a small sodium charge. This is amplified through the sodium structures, sending a rapid-fire signal up the spinal cord to the brain. Our brain then perceives the signal as pain. In congenital analgesia, a genetic mutation means that the sodium channels do not function. The pain never reaches the brain. But feeling pain is actually a crucial part of life, because without pain, we know no limits. The pain of a broken bone is there to make sure that we do not use it again until it is fully healed. With pain, we move in a graceful manner, responding to potential damage, as this is how we can best protect ourselves. So in the case of this incredibly rare genetic condition, less than 1 in a million sufferers, no pain really is no gain. Alas, emotional pain is unaffected, so even with congenital analgesia, a broken heart is still a broken heart. See you next time.
Records of cannabis use for pain date back thousands of years, with some sources suggesting that Queen Victoria's doctor prescribed it to help with period pain.
People have spoken. They've amended our Constitution to legalize marijuana in Colorado.
The relaxation of laws around the use of cannabis or marijuana in some states in America has prompted further discussion on its pain-relieving properties. However, did you know that we are able to naturally produce these key pain-relieving cannabis-like chemicals inside our own bodies? Professor David Finn's research is focused on trying to understand this pain control system better.
So we're interested in how the brain controls pain, the top-down modulation of pain by the brain. And we're particularly interested in a system in the body called the endocannabinoid system.
Endocannabinoid.
That's right.
It has reminiscence of the drug cannabis.
That's correct, yeah. So the endocannabinoid system is the system in our bodies that actually responds to cannabis.
Okay. When we encounter stress or when we are in pain, nerve cells in our body make and release chemicals that actually mimic some of the compounds found in cannabis. These molecules serve to dampen down pain.
Chronic pain is associated with deficits in the body's ability to suppress pain. So what we believe is that if we can restore the function of the endocannabinoid system in chronic pain, then that might be a nice route towards better and more effective treatment of chronic pain.
So if our endocannabinoid systems only get turned on during extreme pain or stress, how are you going to stimulate it without chopping somebody's leg off?
Very good question. So we can take a pharmacological approach. We believe that the body still has the ability to produce these endocannabinoids, even in chronic pain, but that the body may need a little help pharmacologically to increase their levels, and to do that in a targeted manner in key parts of the brain that are involved in pain.
When people hear endocannabinoids, they think of cannabis, but you're hoping to develop a drug that won't have the psychoactive aspect to it.
Yes, there tends to be confusion here. The endogenous cannabinoid system offers a route to try and develop drugs that will be more specific, that will be a more subtle modulation of the cannabinoid receptors than smoking cannabis, but still afford significant therapeutic benefit and relief of pain.
The development of new pain-relieving medicines and therapies is obviously important to those living with chronic pain, but for researchers it requires a thorough understanding of the fundamentals of pain to begin with.
This is a new physiological system in the body. It's a novel chemical signaling system, and we need to understand it better. We need to understand its role in pain, in stress, anxiety, depression. These are conditions that affect an awful lot of people in Ireland and across the world, and we need the fundamental basic research in place to understand the physiology of the system and then build from there towards innovation and clinical trials.
On average, 1 in 4 of us will experience pain at least once a week, and many of us will take some form of pain relief for it. But what if the pill has no active ingredients at all? This is known as a placebo, and it can sometimes have a positive impact on our health. Charlotte Blees is studying what is known as the placebo effect.
So the placebo effect is a genuine psychobiological effect, and it occurs when the patient expects the treatment to work, and as a result of that expectation, the treatment is effective. It's remedial for some of their symptoms. The placebo effect isn't going to cure cancer, it's not going to treat Alzheimer's disease, but it is effective for a range of conditions and symptoms, including depression, anxiety, irritable bowel syndrome, and pain relief.
Placebos are used as controls in medical trials to measure the effectiveness of drugs. But if by taking a placebo some patients actually start to feel better, could it be used as a treatment itself? So how can doctors incorporate the knowledge of this powerful effect?
Well, they could do this by adopting an active listening style, showing empathy and understanding toward the patient and their condition. But we also know that injections are more potent. They raise our expectations a lot more than just taking pills. Pills in themselves, red pills are better for pain relief than blue pills. Really interestingly, some studies conducted at Harvard show that open-label placebos may also be effective.
So even though people knew it was a placebo, it still had an effect?
It actually said that on the pill box, placebos, and telling the patients these are placebos, they're sugar pills, they work because you think they're going to work, but also on top of that saying, but we think that they're going to work, we have confidence that they'll work too. This was just as effective as giving them prescribed standard medication.
But it's mad that taking a red pill is more powerful than a blue pill, thinking that an injection is more powerful, and it's all still just sugar.
It's pure expectation. Yeah.
Wow. The positive health benefits of the placebo differ greatly. A big pill is more effective than a small pill. However, all pills are less effective than a capsule. An injection is even better than a capsule. Branded products work better than non-branded. And finally, the more expensive the medicine, the more effective the results.
in case you're wondering, Aoibhinn hadn't forgotten about our bet.
You have to forfeit something that girls go through all of the time.
Sounds nice. And I'm not the type of guy to Welsh.
Well, folks, we've come to the end of our new series, 10 Things to Know About. We've had a lot of fun and a few scares making it too. I feel like I should, but I don't want to. Okay. Yes.
Oh! Not very good.
You ready?
Yes. Hope to see you all again next time.
You can't come back and haunt them. That's not very nice.
Yes, you can, if they don't do what they're told.
I mean, it's beautiful. I know it's my brain, so I probably shouldn't be saying that.
How are you?
Hi, how are you?
That's absolutely fantastic.
This is experimental equipment on our brain.
Your brain isn't that precious, John.